Sleep apnea. I guess, we've had the program for 20 years, medical doctors on the show. 20 years ago, they didn't use dentists. Now the medical doctors are sending their patients with sleep apnea or breathing problems or snorers to dentists.
Right.
So what is that like? What is it you do as a dentist to take care of sleep apnea? Because we know CPAP works.
Oh, absolutely. It does work, and it works beautifully if you use it, right? If you don't use it, it's just another machine getting dust on the corner.
Okay.
Because most of the people, over 60% of the people, do not wear CPAP. And if they do,
right? Okay.
if they do, it's for a couple of hours a night, and then they just wake up without it, because people feel tight, they feel claustrophobic, they don't feel right with that thing, even though it works, and even though they know that can save their lives, right? So as a dentist, there's options. So we can do a mouth guard, if you will.
So wait, okay, so these are people that breathe pretty much okay during the day.
Oh yeah.
Then they lay down and all of a sudden they can't breathe.
Correct.
So what's happening?
Correct. So that's we call obstructive sleep apnea, OSA, okay, for short. So they lay down, and it doesn't necessarily need to be obese people. Yeah, obese people has more chance to having it, but postmenopausal women, they have the same rate,
okay,
percentage-wise,
okay.
just to take that out of the question. So it's not just obese people. So they lay down, their tongue, their throat gets collapsed, and they stop breathing, and they can be over a minute without breathing, like completely stop breathing. That's what it is. So the appliance that we fabricate will gently reposition their jaw, and there's a technique to find that right position, and will mechanically open that airway. Sometimes.
So the snoring stops as well?
Oh yeah, absolutely. The snore stops, and just out of curiosity, 25% of the Americans, or a couple of American couples, they do not sleep in the same room mainly because of snoring. It's crazy, and we make You want to have more sex?
Okay.
Stop snoring. Okay. Have a better night of sleep. Get rested. Your libido gonna go up, your testosterone level is gonna go up, your depression may be reduced, your heart, if you have trouble with medications to drop down your heart
like blood pressure, things like that?
It helps, because what happens is when you're not breathing, your brain trying to wake you up, so push adrenaline, so your heart beats super fast throughout the entire night. So that's
now when you say that they think they're sleeping, but they're not, like you do sleep tests and they're waking up like 30 times in an hour.
Right.
So they wake up exhausted.
Absolutely.
They were laying in bed for 8 hours.
Yeah.
But they weren't really sleeping.
Yeah, it's not.
Is that right?
Correct. There's not a quality of sleep. They're just there trying to breathe. So their body is not in a restful situation. They're fighting to be alive. The other thing that happens, they grind their teeth to try to take the teeth out of the way for them to breathe. So if you're a heavy grinder, you may be a sleep apnea patient.
So at night, their teeth are rubbing together, makes them flat.
Correct.
Aside from the appearance, why is that bad?
Well, you end up gonna lose your teeth because it grinds down so bad that there's nothing left to work with.
Okay.
Yeah.
What kind of results are you seeing?
Oh, we after we start with this option, which is retrievable, and it's by the way, we talked about most of the people do not do the CPAP. This treatment works, and most of the people are compliant. So 80%, 70+% use the mouthpiece, and it works, all right? A lot easier to maintain. And we do another sleep study, and we compare the before and the after, and the results are staggering. So they're more motivated, they're more...
Because they're sleeping deeper.
Right, they rest. They wake up with like you should, like rested.
Because everybody knows what it's like to not sleep. You feel lousy the next day.
Yeah.
So if you are sleeping, you feel good again. You wake up feeling energized.
Try that when you're young. You could do that, right? Wake up and don't sleep and do whatever you need to do. Now I can't. It's hindered significantly, especially as you age. It's hard to recover that. So you need those hormones, those replenishing hormones, to make you a living human being.
So so you have good results with this?
Oh, absolutely. Yeah.
Do you have people that actually, because we know CPAP works, but do you have people that actually were able to get off the CPAP and just use this?
Yes. Well, most of the people that they're already off CPAP anyways.
Because they can't use it.
They can't use it. So they either risk their lives because of the not wearing the CPAP, or try something else.
Okay. Now, as you said, husbands and wives or partners sleeping in two different rooms because of the loudness.
Correct.
Do you ever hear stories where they're back in the same room?
Oh yeah, we even hear stories that they have children.
Okay.
I was like, well, we're trying to have children, and now we do. It's because now they're a lot more intimate, and it's not like a forced situation or a scheduled thing. So yeah, it's kind of cool.
Okay, good.
And one thing that I forgot to mention, insurance, medical insurance, they cover.
Okay.
So that's a good thing. So there's nothing, the same way that they cover the CPAP, they do cover the thing. Some don't cover 100%, but a lot of them do. So it's a no-brainer. They can save your life. They can put you back in a scene to be active and energetic, and etc., as we discussed. And the medical insurance will cover, let's say, will cover a big portion of it.